Now, India has reported over 17,000 new COVID cases in the span of one day, 17,336 COVID cases in the last 24 hours. Active caseload has now jumped to 88,284. The metro cities of India continue to battle the COVID surge. The trend of high one-day COVID spike is persistent in Mumbai, Delhi and Chennai. Tamil Nadu, for the first time in months now, breached the 1,000 case rise figure. Mumbai logged nearly 2,500 cases, which is a 50% rise in daily COVID cases. Delhi saw a steep rise of over 1,900 COVID infections. On Thursday, Union Health Minister Mansukh Mandavia chaired a COVID strategy meeting with experts and officials. And at that meeting, Mr. Mandavia stressed the need to increase vaccination, testing, as well as genome sequencing to scan for mutations. Ela joining us for more on this from the national capital. Ela, so this steady COVID uptick and the metro cities particularly reporting the COVID spike over the last few weeks now. What are the governments thinking? Are they thinking on the lines of bringing the mask mandate back?
Well, absolutely, Rohit. This is really a concerning matter as the spike in Delhi in COVID cases is double within a few weeks. Over last 24 hours, Delhi recorded around 1,900 COVID cases, and positivity rate is around 8.1%, which is really high. Although there was no death recorded in past 24 hours, but talking about overall country. Over last 24 hours, India recorded around more than 17,000 COVID cases. This is a kind of spike we are seeing after a really long gap, and that's why yesterday also Health Minister Mansukh Mandavia chaired a meeting with all the officials, and he stressed on the vaccination drive and testing, as the government is already working on more and more testing and more vaccination to avoid the fourth wave of COVID-19. Well, talking about national capital Delhi, so mask is absolutely mandatory here, and those who are not wearing masks are being fined. And we have seen that people are not wearing masks and are not really taking COVID protocols seriously as they used to take. But one has to think about those waves like Delta wave, when there was no oxygen, no beds available in the national capital, and the situation was horrifying. And that is why everyone is concerned about the rising cases overall country and Delhi, especially Delhi, so that the fourth wave of the COVID should be avoided, and the government is working on it, and they are working on more and more vaccination and booster shots so that the immunity of people could be built, and a fourth wave could be avoided as much as possible. Back to you.
All right, Ela, thanks very much for joining us with those details from Delhi. Now, if you focus on Chennai and look at the line graph of Chennai, how the COVID cases have spiked over the past 1 week, you can see 1 week ago, the COVID cases were around 300. Now, those cases have jumped to nearly 500 now. This is in the span of the last 7 days. You can see from 289, the cases now rising to 497. Dharini now joining us live from Chennai. Dharini, this graph is quite worrying for Chennai. The cases have been steadily rising. What's the thinking in the government regarding battling this COVID surge?
Well, until 2 weeks ago, Tamil Nadu as a whole was reporting only around 200 COVID positive cases daily. But yesterday, Tamil Nadu reported 1,063 fresh COVID positive cases, and especially Chennai alone had reported 497 cases out of the 1,063 total cases. So this definitely is a very worrying situation because in 5 districts of Tamil Nadu, the spread is seemingly higher. The districts are Chennai, Kanyakumari, Chengalpattu, Coimbatore, and Kanchipuram. So in all these 5 districts, compared to how it was 2 weeks ago, now the number of cases they're on a rise, and the state government is discussing with all these 5 district collectors to as to how to bring these cases down. In fact, the CM is also likely to hold a meeting with Health Minister and Health Secretary very soon to ascertain the situation and to discuss about the further steps to discuss whether to bring new restrictions or not. So, but anyway, at this point in time, this definitely seems worrying, and the health department should do something to stop this spread, because the cases have increased by 100 and 150 on a daily basis. So this clearly means that the spread is happening in public places, and there's a residential cluster problem also, because while talking in press conferences, Tamil Nadu Health Minister Subramanian, he often cites to residential clusters. So all these 1,063 cases that were reported yesterday, most of these cases are residential clusters, like clusters that are happening within family. So the state government has to come up with a plan to reduce the number of residential clusters, and to stop people from going to public places without following any COVID protocols. Because here in Tamil Nadu, whenever we enter a mall or a theatre or a public space, the checking as to whether all the COVID protocols are followed or not, that's not very tight. So that has to be tightened, and the
Yes.
health department should do all the proactive measures to bring down the cases.
The worrying situation there in Chennai as well as the state of Tamil Nadu. Thanks very much, Dharini, for joining us with those details from Chennai.